tool I'm going to share with you is called PMAT for short. It's the Patient Education Material Assessment Tool. And this is also available online through AHRQ, and that website is listed there. The PMAT tool is a systematic method to evaluate and compare the understandability and actionability of patient education materials. It's to help determine whether patients will be able to understand the written materials, and actually they have a program, an evaluation for visual materials as well, video materials as well. And so I'm going to go through the PMAT with you. So the first part is understandability. The patient education materials it evaluates if they're understandable when consumers of diverse backgrounds and varying levels of health literacy can process and explain key messages. So this is in alignment with the standards for health literacy to make sure that there's universal design of patient education materials so that regardless of a person's educational background or their health literacy, they can understand the materials. The second component of the PMAT is actionability, that when that patient or caregiver or resident has those materials, they know what they need to do. They can take action on the materials that you provided. And again, and this applies to people of different backgrounds and varying levels of health literacy based on the information that's presented. So first, I'm going to go through the understandability evaluation. And on the AHRQ website, there is a checklist that you can print out and use for your materials, or you can do it online. And so the first criteria is that the material breaks or chunks information into short sections. So limited information that's necessary. And the scale for the PMAT is a disagree, agree, or very short material is not applicable, okay? So the second is the material sections have informative headers, so they tell the person what to expect to follow. The material presents information in a logical sequence, so things flow normally, logically. The material provides a summary to synthesize what was taught. When you're using visual aids, it's important that the material uses visual aids whenever they can make content more easily understood. So they enhance the written materials. The visual aids enhance the written materials. They don't distract from it. The material's visual aids reinforce rather than distract from the content. And they have clear titles or captions, so you know what they're representing. Illustrations and photographs are clear and uncluttered, and the material uses simple tables with short and clear row and column headings. So next, content. The material makes its purpose completely evident. The material does not include information or content that distracts from its purpose. So you only provide the content that is necessary to convey the information you want to convey. Nothing extra. For word choice and style, use common, everyday language, no medical jargon. Medical terms are only to familiarize the person with the terms when they're necessary and also defined. And the material uses the active voice. When you use numbers, you want to make sure that they're clear and easy to understand, and that the person does not have to perform calculations in order to understand what they need to do with numerically. For layout and design, the material uses cues and arrows and boxes and bullets and bold and large font, highlighting to draw attention to key points. Also, the material clearly identifies at least, this is for actionability. So the person knows what they need to do as a result of this education. The material clearly identifies at least one action the user can take. The material addresses the user directly when describing actions and breaks down any action into manageable, explicit steps. The material provides a tangible tool. For example, if you're talking about diet, use menu planners, checklists, whenever it could help the user take action. Blood pressure, records, any kind of record keeping is helpful. The material provides simple instructions or examples on how to perform calculations, but again, calculations are discouraged. The material explains how to use the charts, graphs, tables, or diagrams to take action, and the material uses visual aids whenever they could make it easier to act on the instructions. So the visual aids are only there for a purpose, and that's a universal concept of the PMAT. So I'm going to take you through an example on the Association of Rehabilitation Nurses website, which I'll show you later, has some resources. One of the resources is a patient education handout. And this is just a snippet from it. And I just randomly selected this, and I thought it would be a good way to go through the PMAT. So here you can see that there's some exercises that the treatment team is recommending for the patient post-COVID. And I'm going to go through the checklist with you on this item, okay? So the first one is the material breaks or chunks information into short sections. I would say yes, that they have these clearly outlined. Each activity is in its short section. The material sections have informative headers. You can see on the left-hand side, the exercise is listed there, and at the top, you have the column in the rows describing the table. The material presents information in a logical sequence. It looks like this is the order of exercises to perform, and it does have the steps of the exercise. Now, I might enhance it a little bit. The instructions are written in a paragraph form. I might have those bulleted so they looked more clearly what the steps of that exercise were. The material provides a summary, not necessarily on this table, but it is later on this document. The material uses visual aids whenever they could make content more easily understood. I think this visual aids are good. They show the person with the hand on their chest to help feel their air expand. And the material's visual aids have clear titles or captions, which they do. And the material uses illustrations and photographs that are clear and uncluttered. So these appear clear and uncluttered. We might have a little more description on that illustration that says maybe the arrow could be pointing to, expand your chest. The material uses simple tables with short and clear row and column headings. Yes. The material makes its purpose completely evident. This is a little bit lacking in this one. And the material does not include information or content that distracts from its purpose. And I agree with that. I think they would score positively with agree on that one because this is very clear and simple. The material does not include information or content that distracts from its purpose. I think I would agree with that. And for word choice and style, the material uses common everyday language. It appears to be about the 5th grade level, which is the goal. And the medical terms are used only to familiarize the audience with terms. And when used, medical terms are defined. And this is very much in lay terms. And the material uses the active voice, which it does. For numbers, we do have a couple numbers in there. And they are clear and easy to understand. It's time, 1 minute or 5 minutes. And there are no calculations required, which is great. And the material uses visual cues, arrows, boxes, bullets, bold, large font, highlighting, and so you can see that there is an arrow to raise the chest. So those are the understandability components, and now we'll get into the actionability components. So the material clearly defines at least one action the user can take. So this snippet gives you actually two. The material addresses the user directly when describing the actions. And this is so. It says lie on your back. The material breaks down any actions into manageable explicit steps, which it does. But then again, I think it could be a little bit bulleted and the steps could be a little bit more clearly defined. And breaks down actions into manageable explicit steps. Yes. Provides a tangible tool whenever it could help the user take action. So in looking at this, I would think that maybe a tool that would help would be a journal that had the person record when they were doing these activities. And that is not included, but I think that's something that would enhance these materials to make them more actionable. And that the material provides simple instructions or examples of how to perform calculations. And that doesn't apply, which is good because it's better not to have those calculations. And the material explains how to use the charts, graphs, tables, or diagrams to take actions. And we don't have charts, but I would recommend that there are charts. And the visual aids used when they would make it easier to act on the instructions, which are present. So I would say that this snippet of this handout meets the majority of the PMAT criteria. A couple enhancements would be to make the bullets there to make the instructions a little bit more clear. And also to have that checklist for the person to record when they're performing those activities. So those are some tools to help us to impart our education on patients, families, and residents, and to help them retain the information that we're teaching them so that they can be more successful when they return home and they're doing these activities in the community.